warm welcome to our viewers today. Looking at this pandemic spreading like wildfire in our country and the toll it's taking on our healthcare system, we have a few key questions to ask our panels here that the common man of India wants to know. Let me introduce our panel for the day. We have Ms. Chaitra, the Union Health Minister from the central government, Ms. Leena, the State Health Minister, and Ms. Shalini, an Assistant Collector. A very warm welcome to our guests.
Thank you.
Let's begin our discussion starting with our Union Health Minister. As a citizen of India, Ms. Chaitra, our viewers would like to understand how the healthcare system of India is organized.
Thank you, Mr. Anand. We all know that India is a union of 29 states and 7 union territories. The central government's responsibility consists mainly of policy making, planning, guiding, assisting, evaluating, and coordinating the work of the state and ministries. At the center, we have the Minister of Health and Family Welfare headed by me. All the state health ministries work under my guidance and supervision. We also have a Central Council for Health that makes recommendations to the central government regarding distribution of aid and makes proposals of laws relating to medical and public health matters. We also have 3 very important departments of healthcare. The Central Drug Controls Organization, which is responsible for the control of drugs and poison. We have the Health Research Department that promotes research to research centers in our country. The Director General of Health Services that heads the ICMR, Indian Council of Medical Research. Ever since the pandemic has started, it is the ICMR that has done research, conducted trials, collected data, and used a uniform protocol to be followed throughout the country by the doctors. It also controls quarantine of all the major ports in the country and international airports. It implements national health programs and maintains the National Medical Library. We also work with the World Health Organization to maintain international health relations.
Thank you so much, ma'am. Now coming to the state government, how it is organized at your level, Ms. Leena?
Thank you, Mr. Anand. We all know that each state has developed its own system of healthcare delivery independent of the central government. At the state level, we have Department of Health and Family Welfare headed by me. The Health Secretary along with the Joint Secretary report to me and is responsible for 4 departments. Directorate of Medical and Health Service, Directorate of Medical Education, Directorate of Public Health and Preventive Medicine, and Directorate of Drug Control. All 4 departments work together and are responsible for the healthcare system for its state.
Thank you, ma'am. Coming to you now, Ms. Shalini, as an assistant collector, what is your role in the system?
Well, Mr. Anand, you have to understand that there are 614 districts in India. Each district is divided into 2 or more subdivisions which are headed by assistant collectors. That's where I come in. Each division is divided into taluks in charge of a tahsildar. Each taluk monitors about 600 villages. We have a community development block for every 100 villages headed by a block development officer. Under this, we have the village panchayat that works for sanitation, public health, and social and economic development of the village. In cities under the BDO, we have town area committees who provide sanitary services. We have municipalities headed by chairmans and corporations headed by mayors who are elected by councils of different wards of the city. Both municipality and corporations are responsible for construction and maintenance of roads, sanitation and drainage, street lighting, water supply, maintenance of hospitals and dispensaries, education and registration of births and deaths.
Coming to the organization of hospitals and clinics in India, how does the government ensure help reaches from the smallest villages to the cities?
Well, Mr. Anand, it is split up into primary, secondary, and tertiary levels. At the primary level, we have the sub-centers and the primary health centers. The sub-centers are designed to serve extremely rural areas with expenses fully covered by the national government. A staff of 2 workers, 1 male and 1 female, serve a population of 5,000 people. They also educate rural people about the healthy habits. The primary health centers funded by the state government serve as a larger health clinic staffed with doctors and paramedics in more developed rural areas of 30,000 people. Patients are referred from local sub-centers to PHCs for more complex cases.
At the secondary level, the community health centers, also funded by the state governments, accept patients referred from the primary health centers. It serves 1,20,000 people. Patients with complications are transferred from here to district hospitals for further treatment. They have newborn, childcare, and blood storage capacities at all hours every day of the week.
At the tertiary level, district hospitals are the final referral centers for the primary and secondary levels of the public health system. It is expected that at least one hospital is in each district of India, although in 2010 it was recorded that only 605 hospitals exist for 640 districts. There are normally anywhere between 75 and 500 beds here. Lastly, coming to the medical colleges and research institutions, All India Institutes of Medical Science, AIIMS, is owned and controlled by the central governments with specialized facilities. AIIMS is in New Delhi, Bhopal, Bhubaneswar, Jodhpur, Raipur, Patna, and Rishikesh. Government medical colleges are owned and controlled by the respective state governments and also function as referral hospitals.
I would like to thank our esteemed panel of guests today for giving us this fabulous insight of India's healthcare system.
It was our pleasure.
It was our pleasure. We have now composed a poem that is a message from the doctors and healthcare workers to the common man.
We did good. Who would have thought soft intellectuals could be warriors, sent to the front lines unprepared? Our armor, a thin PPE kit, sufficing to protect us from being hit.
When we go out, our weapon is a liquid sanitizer. Our shield, a flimsy mask. We need to leave our loved ones behind to meet the need of the hour.
We work around the clock, yet our enemy works against us non-stop. The deafening silence in the hallways at night makes us search for a hopeful light.
My head barely touches the pillow and I'm called again. Tears of gratitude in their eyes makes me want to do it all over again.
The rich and the poor knock on our doors, thinking the hand of God is somewhere close.
Death weighs heavily on our souls. There's no hope, no sound. We are so cold. How we wish for a warm, tight hug, a sincere voice that says, "You did the best you could." Then comes a shining light. We see people joining the fight, maintaining social distance, sanitizing, doing what's right.
Our burdens feel so heavy no more. Locals, NGOs sharing the load. Neighboring countries opening their doors. Number of infections stopping to soar.
Timely medication will save you, Take vaccination. Watch your children grow. Stay at home. Take precaution. Responsible behavior, the only solution. Then only can we hope to see a better tomorrow. We salute to the doctors, nurses, and all the healthcare workers of our country who are fighting on the front lines of the pandemic, risking their own lives to save the nation.
For my action, I made a contribution for the procurement of COVID supplies for India.
I donated a mask and a sanitizer for safety of an employee working with my dad.
I made a contribution to the Mentra website for COVID supplies for my action.
I donated masks and sanitizers to help others stay safe.
These are some of the practices we have adapted in our lives as action.